Randy Snavely and his fiancée Kristen enjoy spending time out on the road on their motorcycle. But about 4 years ago, Snavely was diagnosed with lung cancer.
I didn't really notice anything until I quit eating, and I thought there was something wrong. So I went to my regular doctor, and she had me take x-rays, and that's how they found out I had it.
So he was diagnosed with an advanced lung cancer from the very beginning, so a stage 4 lung cancer. And usually that's treated with a combination of chemotherapy and often immunotherapy medicines that help to stimulate the immune system to help control the cancer. And that's what he got as part of a trial in First Line.
After that, it was decided he should try a TILs therapy.
The idea behind this kind of therapy is that the TILs, these parts of his own immune system, can go back into his body and actually help to attack the cancer. The first steps actually are to have an operation to remove a small amount of cancerous tumor, and then that is taken to a lab where it's processed to isolate the immune cells that are inside of the tumor.
The next step involves Snavely receiving chemotherapy to help prepare his body to receive the cells, or lymphocytes, back into his body.
Lymphocyte is a type of white blood cell. We have lots of different types of white blood cells, and a lymphocyte is a part of the memory system of our immune system, or the memory of our immune system, that can be sort of trained in a way to attack certain bugs, germs, for instance, but also can participate in cancer control. Okay. After they receive that chemo, they receive, kind of like a blood transfusion, their own lymphocytes back into their body via an IV. And then they receive a medicine called IL-2 that stimulates those cells to grow in the body, and they become the dominant part of the immune system that attacks the tumor. The idea is that these very lymphocytes that are removed, the tumor-infiltrating lymphocytes, or TILs, are the cells that would be the most educated, if you will, against the cancer.
Now Snavely continues to come in every 3 months for a checkup.
I'm real happy with what I did go through, because it kept me going.
Going on to his next adventure on his motorcycle.